Surgeonzameer, consultant pediatric surgeon at Narayana Health, Bangalore. Today, I am going to speak about a serious congenital anomaly that we come across, which is commonly called as CDH. What is CDH? CDH is basically the short form for congenital diaphragmatic hernia. The diaphragm is a muscle that separates the chest from the abdomen. Congenital diaphragmatic hernia is a congenital anomaly in which there is a defect in this diaphragm, because of which the abdominal contents rise and lie within the chest. The common contents that lie in the chest are the stomach, small intestine, large intestine, or even a part of the liver. Most of the time, it occurs on the left side. So what is the basic problem with CDH? In CDH, you have a structural defect in the diaphragm. We have the abdominal contents lying within the chest. So what happens is, all this, say we have a diaphragmatic hernia on the left side, the intestine, stomach, all of this lie in the chest. They compress the left lung. They push all the structures towards the right. So the lung, even the heart, is pushed towards the right. There is poor development of both the lungs. And also, there is something called as pulmonary hypertension, in which there is increased blood pressure in the vessels of the lungs. How is CDH diagnosed? In today's era, most of the cases of diaphragmatic hernia are diagnosed by antenatal scans, that is, ultrasounds done in the mother's womb. After birth, the baby has respiratory distress, that is, the baby has difficulty in breathing. The oxygen saturation will be low. It is easily diagnosed or confirmed with a plain X-ray of the chest, which show the intestine lying within the chest. Rarely, these cases even present a little later in childhood or even in adults. How is it treated? Congenital diaphragmatic hernia is a medical emergency. It's not a surgical emergency. So, the most important aspect in the management of CDH is initial stabilization, which involves ventilation, maintaining the blood pressure, and reducing the pulmonary hypertension. Once the child is stable, then we can proceed with the definitive correction of the hernia, that is surgery. The stabilization may take even 2 to even 5 days or even more. The surgery for it is basically reducing all the contents, that is, bringing down all the intestine and other contents which lie in the chest into the abdomen, repairing the defect in the diaphragm. This can be done by open surgery or even by minimal invasive or keyhole surgery, that is, laparoscopy or even thoracoscopy. One must remember that one must not rush into doing a surgery in these cases. Initial stabilization helps in getting a better overall outcome. What is the prognosis for CDH? The overall mortality for CDH is as high as 40 to 50%, and this is primarily because of lung hypoplasia, that is, poor development of the lungs. We at Narayana Health Bangalore have excellent intensive care facilities, have a good support for pediatric intensivists, the neonatologists, anesthetists, and the pediatric surgeons. So the survival in Narayana Health is to the range of 80 to 90%. So if the lungs are fairly well developed, all other associated problems with CDH like pulmonary hypertension, that is low blood pressure, and all can be maintained, can be taken care of because of the extensive monitoring, availability of newer facilities like nitric oxide, sildenafil, and even ECMO at NH.